So let's then talk about elbow challenging and elbow adjusting. When we just had that last workshop, did anyone find a therapy localization to any of the elbow bones? You had it? You had it? Several of you had it? Okay. We can use shock absorber on the elbow, and we might try that. We'll see. And see if it weakens. You can also use shock absorber on the wrist, as we'll show later, which sometimes will also challenge because of the pressure through the wrist, and the radius and ulna can also be used for an elbow problem. You can challenge the radius, and usually you challenge the radius proximally. In an elbow problem, you could have a problem. In a wrist problem, you could have a problem with the radius. In an elbow problem, you could have a problem with the radius. Same with the ulna. But we're just going to focus on the elbow now. We'll talk about the wrist later. But you challenge in the elbow, the radius in the ulna can be subluxated, and you challenge the radius either in rotation in two different directions, as you see, sort of P to A and A to P, or you can also challenge it. Let me go back. You can also, if you find a component in that nature, then you can challenge it superior, or I should say maybe proximally and distally, to try to find a vector. And when you're trying to adjust the elbow, it's very useful, especially in the radius if it's subluxated, to try to find the appropriate vector. So you go A to P, P to A, inferior to superior, superior to inferior. I guess I should say distal to proximal, proximal to distal, whatever. The same thing with the ulna. You can challenge the ulna, and usually the ulna challenge will be lateral to medial or medial to lateral, but also the ulna will challenge distal to proximal, proximal to distal. But notice what we did here is we have the ulna challenged lateral to medial, medial to lateral, and we look at the picture. And then from here, notice that we've done the same thing. We've put the hand in pronation and challenged the ulna, lateral to medial, medial to lateral. And then we put the elbow in supination and challenged lateral to medial and medial to lateral. And so we make an adjustment. Here's an adjustment of the ulna medial to lateral. And usually what you want to do also is you have this component. You want to find a vector along the line of the bone. So most of the time the ulna is going to subluxate. It's going to subluxate in a distal direction. So you want to go medial to lateral or lateral to medial, and then also in a more direction toward the line that follows the long bone direction. So here's an ulnar adjustment lateral to medial. Now, in a general sense, the elbow, especially the ulna, but either the radius or the ulna, and I shouldn't say especially, either the radius or the ulna is easier to adjust with the arm over the head. Don't know why. Dr. Gart taught me that. It's true. So you want to find the vector, and then you want to adjust it with the arm over the head. So who had an elbow that TL'd that I might demonstrate this on? Carl, come on up, please. I don't know why this keeps doing this. It is, but it shouldn't do it in my presentation mode, should it?
I think you have to disable that.
Yeah, I need to disable it, and I got a bunch of things that I label or disable here.
We'll do that.
Enable or disable. We'll do it later? Okay. Okay, so which one? Okay, and did you have any muscle weaknesses there?
Yeah, we had, but it might be fixed now, but the long head of the bicep was weak, and
Okay.
pronator quadratus was weak.
Sit up here for me, please. So let's try, I'm going to sit next to you here. Let's try the pronator quadratus. Pronate the hand, resist as I twist. Again, resist. Okay, again, hard as you can. Resist. Okay. Now, I usually do this with one hand, but I can't do it in this position, so it's weak, okay? Now, one of the things we could do is you had the long head of the biceps too. Push up. And that's strong. We could do a shock absorber effect. You can do shock absorber on the elbow. So, hold. And that's strong again. Now, we got to test a muscle to identify this challenge mechanism I want to do on his elbow. But let's first TL. Hold, resist. Now, touch your radius here. Kind of lay it across like that, okay? Hold, resist. Okay. And touch the ulna back here. Or you can come around from the other side if you like, okay? Touch the ulna, right on that head of the ulna back here. Right, that's it. Hold. So this is an ulna subluxation. So let your hand relax. Now we have to identify the subluxation. And hold your arm up here. I'm going to do this with a pectoral muscle. Resist. Pectoralis major clavicular. And then normally what I would do is I would use an opponent's muscle. Hold here. and challenge because it's all on the same side and it's close. But for this purpose of demonstration, I'm going to use his opposite pectoral muscle. And so I've got an ulna, so I'm going to challenge the ulna, medial to lateral, like that, push, and lateral to medial, push. Challenge is lateral to medial. And remember, we're going to adjust in the direction opposite the direction of weakening. So I'm also going to challenge it along the long bone lines. I'm going to challenge it from proximal to distal and lateral to medial. So I'm pushing it, actually stand up, let's do it like this. Turn around this way. So I'm challenging it lateral to medial, hold your arm up, and that weakens them. Now I'm challenging it still on the lateral side, hold, resist, and it doesn't challenge, if I challenge distally, challenge it proximally, resist, and it doesn't challenge. So it seems to be more of a lateral component, not a long waist component, length waist component. A lot of times you have to adjust in the upward direction, but this one, we challenge it from lateral to medial, hold. That means we need to adjust it on the ulna from medial to lateral. So I'm going to adjust it from medial to lateral with my thumb on this side, pushing out like that. Now, let's have you lie on your back, please. One of the things you can do, take the arm up over the head, and you'll challenge it. You can challenge it in the normal position, but you can adjust it with the arm up over the head. But let me just come back down here and try something else. If we rotate him into supination, hold your arm up. We supinate his hand, resist. And we challenge it from lateral to medial, push. It challenges. And if we pronate his hand, and we do the same challenge, hold. Okay. It challenges the same whether it's pronated or supinated. Sometimes one way will challenge and the other way won't. In this case, it challenges either way. And it's useful to do that so that after the adjustment, you can make sure you've corrected it by challenging it in a way that perpetuates the challenge. So it's lateral to medial. So we're going to adjust medial to lateral. I'm going to adjust them this way, the arm over the head. Okay. Hurt? It's not supposed to hurt. Let me challenge lateral to medial again. Hold again here. Resist. And it did strengthen. It didn't make a big pop. But if we turn it all the way this way and challenge lateral to medial, hold, resist, and turn it all the way the other way, challenge lateral to medial, hold. You can challenge it in pronation or supination, and you'll pick up a component that you won't pick up otherwise. So that's what I was trying to show you. Now, he showed the same in lateral. He showed the same in pronation and supination, so the same challenge. After we made the correction, showed the same challenge. And the adjustment hurt him a little bit. And usually when you take the arm over the head, the adjustment doesn't hurt. Or if it does, it hurts far less than it would if it was at the side. So sit up again, please. But remember this pronation supination trick, because you'll adjust it and it won't challenge anymore. But if you put it in the direction that aggravated the challenge, it will still challenge if you didn't get it right. Hold your arm here again. Pronate. Resist. So we got it fixed. Thank you. Okay. Who else had an elbow subluxation? Mind coming up? So we will just try to see if we can find this supination pronation pattern here. Yes, sir.
If you had seen that ulna challenge in either supination or pronation, would that have influenced the position that you would adjust in?
Yes. Well, if I found that, and that's what I'm trying to find. If I found it only showed up in pronation or supination, would I adjust it in one of those positions? Yeah, I would. Now remember that the rule for extremities is you adjust in the direction of strength. Okay, so if you're trying to correct it, what I'll tell you is try adjusting it with the arm where the challenge is. Well, let me see if I can show it to you. Is it this arm here?
No, it's this one.
Okay, let's try and shade sides. Okay. Did you have any weak muscles?
When I TL'd the ulna, the supinator weakened, yeah.
Okay, so nothing weak in the clear.
No.
Okay, well, let's do this.
I don't think there's anything weak in the clear.
No.
Okay, so if there's nothing weak in the clear, I'm just going to TL the elbow. But wait.
Okay.
Lift your knee up. Hold. TL the elbow. Okay, so it TL's at the ulna. TL the radius over here. Okay. hold, resist. Okay, so it shows an ulna TL. So challenge medial to lateral, hold your arm up here. I'll use this muscle here. Challenge medial to lateral. Let me try again, turn. Medial to lateral, lateral to medial. And it doesn't challenge. Let me challenge from proximal to distal, and from distal to proximal. It doesn't show up. But it TL'd. So let's try pronating, challenging medial to lateral, lateral to medial, okay, and distal, proximal to distal to proximal, proximal to distal, okay. And I'll put it in supination. Challenge medial to lateral, lateral to medial. There it is. Only shows lateral when you put them in supination, lateral to medial. Push. And now let's just see if it challenges on the lateral side. I'm going to challenge it towards the distal and towards proximal. So hold. Doesn't challenge. Doesn't challenge if I challenge it down, but it challenges if I challenge it up, interestingly enough. So I challenge from lateral to medial and distal to proximal. So it challenges like that, which means the correction I want to make is going to be the opposite direction. So I'm going to adjust him from medial to lateral. I'm going to adjust in a downward kind of a direction like that. And then the question is, do you adjust it in the direction like this that aggravates the subluxation, or do you adjust it in the direction opposite of that? And you could try it both ways and see what works, but what I'm going to do is, because I have that component, I'm going to actually help it to go back in place and adjust in the direction of strength. Now, if that doesn't work, I'll do it the other way. But, so, pushing up and that way weakens, okay? So I'm going to put it in pronation and adjust. Is that right? Let me try it again. I'm pushing lateral to medial, right? And if I push from proximal to distal, distal to proximal, right?
Yeah.
So it challenges that way, so I'm going to adjust it on the other side and in a distal direction. Line your back for me, please. I'm going to adjust this way with his arm in this position, here. Okay. That's it. Okay, like that. Let me do it one more time. Did it hurt? No. If it doesn't hurt, you can try again. I like to get him to pop, you know, but there it goes. Pop that time, didn't it?
Yep.
Sit up for me, please. Okay, so supinate, good.
Okay.
And challenge in the direction that made it weak. Hold here. And challenge in the direction that made it weak up. And challenge in the component of the two vectors. And that's how you fix it. And try adjusting it in the direction that opposite from where the challenge shows, in the direction of strengthening. You adjust in the direction of challenge strengthening with the arm in the direction of pronation or supination, which strengthens. If it doesn't work, try it the other way. But a lot of times that will help you to make the correction easier, especially when you do it over the head. Okay, thank you.
Thanks.
Any questions on that? And elbow adjusting should not be painful. That's why I ask if it hurt. And I asked before if it hurt. It usually shouldn't hurt. Sometimes it hurts. But taking the arm over the head dramatically decreases the amount of discomfort patients have. I think maybe they relax more or something. I don't know why. It's just something Dr. Goddard taught me years ago. And I've tried to always take the arm over the head and make the elbow adjustment. I can't always do it because sometimes the person's got a shoulder problem. So then you just kind of do it by the side. But consider that component, consider the pronation supination component. Okay?